Most of us think of sleep as dead time, yet it's actually an active state during which the brain and body regenerate. For this reason, a good night's sleep is essential to a good day's productivity. During sleep, the body repeatedly cycles through 4 stages of non-rapid eye movement sleep, or NREM, and 1 stage of rapid eye movement sleep, or REM. Each of the 4 stages of NREM sleep can last from 5 to 15 minutes. During stage 1 of NREM sleep, you can be awakened very easily. Many people experience a feeling of falling, which can cause a sudden muscle contraction known as hypnic myoclonia. Often, hypnic myoclonia will cause an abrupt awakening. When the body enters stage 2 of NREM sleep, the heart rate slows and body temperature drops. Muscles tighten and then relax again as you prepare to enter deep sleep. Stages 3 and 4 of NREM sleep are also known as slow wave or delta sleep. If aroused during these stages, you may feel briefly disoriented before awakening fully. During the delta sleep stages of NREM, the body repairs and regenerates energy, builds bone and muscle, and strengthens the immune system. After the body cycles through its first 4 stages of NREM sleep, generally 90 minutes after sleep onset, it enters the first course of REM sleep. Then you begin the cycle again, passing through the 4 stages of NREM before re-entering REM sleep. Each subsequent stage of REM lengthens until the last segment, which may last for up to an hour. During REM sleep, the eyes move rapidly in different directions, hence the term rapid eye movement. Heart rate and respiration also speed up and become erratic. Dreaming only occurs during REM, as a result of the heightened brain activity in this stage. Paradoxically, during this time, your muscles are paralyzed. To be properly restored and regenerated, the body must repeatedly cycle through all of these sleep stages, usually for about 7 to 8 hours a night in adults. If you have trouble falling asleep, or can't sleep through the night, if you wake up too early, or if you are tired during the day, you may have a sleep disorder. Common sleep disorders include standard insomnia, sleep apnea, narcolepsy, restless leg syndrome, nightmares, and sleepwalking. Because the body needs sleep to properly restore and repair itself, it's vital to get your uninterrupted 8 hours. If you're not sleeping as well as you should, please see your doctor. Insomnia is certainly not rare. In fact, there are upwards of 85 recognized sleep disorders affecting more than 70 million Americans. Let's look at some common sleep zappers. The most basic sleep disorder is called insomnia. People with insomnia just don't get enough sleep at night, either due to difficulty falling asleep, frequent nightly awakenings, or early morning rising. Insomnia can be acute, meaning that it lasts for less than a month, or chronic, lasting for a month or longer. Acute insomnia can result from periods of stress, illness, or physical discomfort. Some medications can cause temporary insomnia, as can environmental factors, like a new location, bright light, or excess noise. Chronic insomnia, meanwhile, is more often related to depression, anxiety, or unremitting stress. Another common sleep difficulty, a circadian rhythm disorder, results from disruptions to the body's internal clock or 24-hour sleep cycle. This clock is actually a small part of the brain called the suprachiasmatic nucleus of the hypothalamus, which rests above the nerves leaving the back of the eyes. Common causes of circadian rhythm disorders include jet lag and working odd hours. That's because unusual exposure to light and changes in activity can effectively reset the body's clock, moving it forward or backward and making sleep difficult. Snoring is present in up to 45% of Americans and can present problems when the noise is so loud that it awakens the sleeper. This rattling sound is produced when the air you inhale passes over the throat's relaxed tissue. Sometimes snoring can point to a more serious problem known as sleep apnea.
OSA, or obstructive sleep apnea, is both the most common and the most troubling sleep-related breathing disorder. OSA causes a person to stop breathing repeatedly during sleep. These nighttime pauses in breathing prevent restorative sleep and have far-reaching consequences for overall health and well-being. When most people are asleep, air flows freely through the upper airways into the lungs, giving a stable level of oxygen in the bloodstream. In individuals with OSA, the tongue and soft tissue in the airway relax during sleep. As the tongue and tissue partially obstruct the upper airway, it causes loud snoring. When the tongue and tissue totally obstruct the airway, it causes an apnea and breathing stops. The chest continues to move as the person tries to breathe, but the blockage prevents fresh air from reaching the lungs. The oxygen content in the blood goes down. An apnea may last anywhere from 10 to 60 seconds before the brain recognizes that there is a problem. The brain briefly arouses the body from sleep, just enough to open the airway. The person with OSA can be observed snorting, gasping, or choking for breath as the airway opens and air flows back into the lungs. After several breaths, the oxygen level in the blood is restored. The individual falls back into a deeper stage of sleep. The tongue and soft tissue relax again, and the airway becomes obstructed. Apneic episodes can happen hundreds of times in a single night. The individual is most often not aware of their frequent arousals from sleep. They wake up feeling exhausted and sleep deprived, even though they spent adequate time in bed sleeping.
Restless leg syndrome is a condition where a person experiences severe discomfort in their legs and feet, which can often only be eased by walking around. Because this syndrome peaks during the night, it can cause hours of sleep lost to restless pacing. Sometimes, restless leg sufferers experience erratic leg movements during sleep, which can disturb the body's sleep cycles. Sleepwalking is a disorder that occurs during non-REM sleep. Sleepwalkers can perform any range of activities while they aren't awake, such as turning on the TV or making a sandwich. Yet, they will often not remember the nocturnal events the next day. Another sleep stealer is narcolepsy, a brain disorder that causes daytime sleepiness. People with narcolepsy experience constant tiredness during the day and often find long naps refreshing. On rare occasions, narcolepsy can result in brief sleep attacks where sufferers fall asleep in the middle of the day while going about their normal business. Restorative sleep is vitally important, so if you are experiencing signs of a sleep disorder, please see your doctor to discuss treatment options. No matter how well you may think you are adapting to limited sleep, the truth is that a short sleep schedule will impact your day-to-day functioning and impair your long-term health. So how much sleep is enough? In a standard 24-hour period, infants require 16 hours of sleep. Children tend to need 10, teenagers should get 9, and most adults need 7 to 8. Pregnant women, particularly those in the first trimester, may require up to 11 hours of sleep. But doctors agree that the bottom line is, if you feel drowsy during the day, you haven't had enough sleep during the night. In the short term, sleep deprivation can lead to decreased performance and alertness during daytime activities. Reducing sleep by just 1.5 hours can lead to a 30% reduction in alertness. In fact, over 100,000 car crashes and 7,000 accidental deaths each year are attributed to drowsy driving. If you're not getting enough sleep, your cognitive function, and your memory in particular, suffers a blow. This can make it difficult to think and process new information on the job or at school, and can double the risk that you will suffer an occupational injury. Sleep loss can also lead to a host of serious physical maladies over the long term, including an increased risk of heart disease and high blood pressure. In addition, because the body repairs and strengthens its immune system during non-REM sleep, people who don't sleep well are at an increased risk of catching a cold or the flu. There is some evidence that not sleeping well is a factor in obesity. Whether this is true or not, it is certainly a fact that sleeping well is as important to your health as eating right and exercising. Recurrent insomnia can also lead to severe depression. Conversely, people who are depressed often have trouble sleeping, resulting in a vicious cycle. Romantic relationships can be negatively affected by poor sleeping habits as well. Not only do restless sleepers disrupt the sleep of their partners, they are often irritable and moody during the day. Hardly a recipe for romance. Clearly, not sleeping enough during your nighttime hours can have big consequences for your daytime ones. Because a host of factors can contribute to sleep loss, talk to your doctor about what may be causing your insomnia. The treatment of sleep disorders can be divided into two basic categories: behavioral therapy and medication. A successful plan may incorporate elements of both. Sleep aid medications are often a short-term option for treating insomnia. They tend to provide quick relief from wakefulness, but can also result in addiction, and may have decreased effectiveness over time. Benzodiazepine hypnotics are one class of prescription drugs that are commonly used to treat insomnia. These drugs include temazepam, which is sold under the brand name Restoril, and flurazepam, also known as Dalmane. Here's how benzodiazepines work. GABA is an inhibitory neurotransmitter found in the brain. When these medications enter the brain, they bind to a receptor on GABA, creating a sedative effect which induces sleep. These medications tend to have long-lasting action and are most beneficial to those who frequently awaken during the night. Another group of medications, the non-benzodiazepine hypnotics, are chemically different than benzodiazepines, but have a similar method of action. They also work by binding to a sleep-inducing receptor on GABA. Non-benzodiazepines include esopiclone, which is commonly known as Lunesta, and Zolpidem, which is sold under the name Ambien. These quick-acting but short-lasting medications are the most effective for people who have trouble initially falling asleep at night. Certain antidepressant medications are used to encourage sleep when chronic depression leads to insomnia. Examples include trazodone or Desaril and nortriptyline or Pamelor. As with all prescription medications, sleep aids can be addictive and should only be used under the direct consultation of a doctor. People who work odd hours or suffer from jet lag may have a disruption in their circadian rhythm, which is a disturbance in the body's natural sleep-wake pattern. These individuals may benefit from taking over-the-counter melatonin supplements. Melatonin is a hormone which is naturally released by the brain's pineal gland. While medications can be a great option for short-term insomnia, behavioral therapy is often necessary to make the changes that will lead to a lifetime of restorative sleep. Sleep hygiene measures are simple actions you can take to correct factors that stop you from getting sleep. Common examples include maintaining a regular sleep schedule 7 days a week and only using the bed for sleeping and sex. People who lie in bed with their minds racing may benefit from relaxation therapy, which entails practices like progressive muscle relaxation and meditative breathing. If you suffer from a sleep disorder, your doctor will probably combine behavioral therapy with medication to treat the problem. These therapies all have high success rates, so the odds are good that you'll be sleeping soundly in no time.